Once you have submitted a case and the 3D plan is ready, there are some steps to review it. If you submit for a deep CBCT case, the first step will be to check the bone and root views. In these views, you want to observe the bone level at each stage of the treatment. Also, the presence of any dehiscence and fenestrations. Ask yourself if you're comfortable with the amount of bone recession that you're seeing, if any. Rotate the models to lingual so you can see the patient's full situation. In this particular case, the doctor was happy with the treatment plan because the patient started with a lauter red of vocal, which means a thin cortical plate, as you can see here, and ended up in green, which is a much more favorable situation. A word on dehiscence and fenestrations, since this is a common question. Please understand that bone recession is bound to happen with orthodontic movements, especially for adults. There is no set standard for the amount of dehiscence that is acceptable long-term for the stability and periodontal health of your patient. Regardless, it is accepted that orthodontic-induced dehiscence, as the one you see here on the left, can compromise all these outcomes. Particularly here, as this dehiscence seems to involve several teeth and is extensive, I personally would not feel comfortable with this 3D plan. On the right, we see a much better situation. The bone recession is approximately 1 millimeter in just one tooth. This seems much more reasonable, and I will feel comfortable proceeding with this treatment plan. Regardless, this is your decision as the clinician, but it is important to set expectations. The second step to reviewing a 3D plan is the occlusion. Please make sure you're seeing the occlusion view. Remember that green is normal occlusion and hyperocclusion is shown in red. Don't be alarmed by hyperocclusion during treatment, as this is normal. But keep in mind that at the end of the treatment, you may have to adjust the occlusion. Also, please make sure you check the occlusion, molar, and canine class to coincide with your prescription. We will always match the occlusion to the scans and the pictures. But if you want to have a point of confirmation, you can always take your intraoral pictures after asking the patient to tap on a horseshoe articulating paper. This way you can check those occlusal contacts match the ones we show you on the 3D plan. The third step is to evaluate overjet and overbite. Please do this by zooming in on the model's inocclusion. And please always check lingual to make sure you are evaluating the overbite appropriately. Next, check the upper and lower alignment. There are two parts to this. The first one is using the grid, which 1 millimeter is 1 square, and this is useful to check the alignment on anterior teeth. The alignment can be to the incisal edge or to the gingival margin, depending on your prescription. The second step is to check each arch separately to make sure that the arch form that you have envisioned has been accomplished, and also to check for any unwanted rotations. The last step, and one that you should only check if you submitted a CBCT, is to check the path of movements. For this, once again, refer to the root and bone views. It is useful to scroll back and forth to get a good sense of the movements happening at each step of the treatment. Please observe the roots carefully. Are there any collisions, any unwanted tipping against maxillary sinuses that are preventing movements, for example? Note that we will always try to prevent root collisions and unwanted movements. But if any do happen based on your prescription, we will inform you of them so you can make a decision. Once again, don't forget to check the models from lingual. If you want to have a quick reference guide for all the steps, you can go to your doctor's profile on the portal and click on the 5 steps to 3D plan review under our manual section. You can print this page and have it handy. Finally, do not forget to check your 3D plan report to plan your appointments and have a roadmap for all your treatment. For more details, please watch the video dedicated to this document.